Hello and good evening, everyone. Welcome to the 123rd session of Mero Eye's iTalks webinar powered by Mero Eye Academy. This is Miss Solu Gautam signing in as your host for this session, and I'm so glad to have you all here this evening. So, prior to the beginning of today's session, I would like to request you all to drop your queries that you have in between the session to our live chat box on the YouTube. We'll be discussing each of your queries at the end of the session. So for now, I would like to move ahead to inaugurate today's session. Joining us today is a speaker, Ms. Paula Mukherjee, all the way from Bangalore, India, who is a consultant optometrist and fellow of ASCO on dispensing optics. Also, she is the operations manager at Optometry Council of India. She will be shedding light on the best practice standards in optometry. So, Paula ma'am, I welcome you to our platform on the behalf of Mero Eye and all our participants. Over to you, ma'am.
Hi, everybody. Very good evening from India, and thank you for inviting me. Okay. So, Solu, shall we start with the slide share?
Yeah, ma'am. Please proceed.
Okay, fine. So, before I begin with the slide share, to all the viewers who are seeing this, this is a very generic presentation because when I was approached to give a talk in this platform, so I thought that, okay, there are a lot of learned optometrists who will give you more information on the specific topics of optometry as in subject knowledge. But there might be very few people who talk about the best practice standards, because best practice standard is something which everybody of us, because one day we will be becoming professionals. I am a professional. Students who are watching, once you pass out, you will become professional. And in your professional front, what are the standards that you should maintain to become a proper professional? That is what I thought should be my talk, because I have been doing this from the past 6-7 years with Optometry Council of India. And this is absolutely an India perspective. I know that Nepal has their own professional council, and optometry is regulated through that. So yes, you will have your guidelines, but this presentation is a more generic one. And best practice standards is something which is applicable to the entire world. And this will be more of a perspective which is when young optometrists, they want to open their own practice, they want to have their own practice, it will be helpful for them. So off to the presentation. I'll switch off my video. Am I audible to everybody? Solu, am I audible?
Yeah, ma'am, you are.
Okay. So as I have introduced that what will be my topic and my talk today. Now, just to discuss what is the definition of best practice standards in healthcare, it refers to a systematic process involving the identification, collection, evaluation, dissemination, and implementation of information and the monitoring of outcomes of healthcare for population and define indicators or conditions. Now, models of best practice aims to improve population health by basing healthcare practices on the best available evidence for implementing effective and cost-effective healthcare interventions. So here I have put on two definitions, and they perfectly say that why standards are required. And as healthcare professionals, we have to maintain standards so that it is effective to the entire population, because we are the fraternity which helps the community. Now, as I said that this will be an India perspective, the scenario of India, first of all, I would like to give you a scenario of optometry in India. Now, currently, optometry does not has a guideline for best practice standard to be followed. In March 2021, the National Commission for Allied and Healthcare Council bill was passed in both the houses of parliament, and it was signed by our honorable president, and it became an act. So it's a very new act which has been signed, and optometry has been regulated under this act. Optometry will be coming under the Ophthalmic Science Council. So what is present in Nepal from, I think, 2004, if I'm not wrong, we have got it now. There are total 56 professions which have been regulated under this act, and optometry is one of them. And optometry has also been considered as a healthcare profession. Now, what is OCI? OCI has been acting as a self-regulatory body in the absence of a central government regulatory body since the year 2012. And OCI has formulated the best practice standard document, which today I'm going to discuss with you. Again, I'm saying that this is completely an India perspective because we do not have any guidelines from the government of India. This document was a handy book which was released by Optometry Council of India for the fraternity. This document is based on and modified from the recommendations by the Australian Board of Optometrists and American Academy of Optometry best practice guidelines. Now, this is a screenshot which I have taken so that because there might be a lot of students who are watching this and they have completed their optometry from India maybe. So very good news for them as well. Now, this is what the Ophthalmic Sciences Professional, and these are the nomenclatures which will come under, which is optometry, ophthalmic assistant, and vision technicians. And the codes what you are seeing are the ILO codes, that is the International Labour Organization codes. So this is what is the act in short. Okay, now to come into the best practice standard guidelines. Now to introduce basically, an optometrist-patient interaction is completely successful only when the optometrist combines expert skill with good communication. I'm sure everybody will agree. It is crucial for patient satisfaction and maintain a healthy relationship between the eye care practitioner and the patient. So this is the very core of optometrist and patient interaction. Now, in a gist, what your patient wants to know basically. So whoever is listening, the aspiring optometrists or whoever is going to complete optometry or are new into the profession, what generally your patient will want to know. So these are the few questions which are very common, and these are the probable questions which will be in the mind of your patient. And if you can answer them, nothing good like that. So when the patient should get ocular or systematic status reviewed or contact you again. So when the patient should get an ocular examination done. Now that is one probable question. Who is the best person to prescribe management for the condition? Where is the affected area? Either ocular or systemic. Why? They will have a question, why has this happened? What is the probable cause and associated factors for the condition? What will be the result of the complete examination? Now, because we are into ocular discussion, yes, what will be the result of the complete ocular examination? And how can the condition be managed? So overall, if all these questions are answered and you can give the answer, then nothing good like that. Now, I have put this as general optometric examination for adults. And this is, again, I'm saying that this is India perspective, and it is according to the best practice standard guidelines which we have created, which OCI has created. So it includes history, visual acuity, refraction. Now, visual acuity, for example, I'll say you measure the monocular and binocular with and without the patient's most recent spectacle or contact lens correction. Refraction, measurement of the patient's most recent optical correction. Now, the procedures involved may be in visual acuity, distance visual. These are the generic things I'm saying. Distance visual acuity, near visual acuity, pinhole acuity when indicated. Visual acuity at identified vocational or avocational working distances. Color vision, contrast sensitivity if applicable. Refraction, objective measurement of refractive status, including cycloplegic refraction if needed. Subjective measurements of refractive status. Ocular motility, binocular vision, and accommodation. So the objective will be to evaluate the ocular movement in the cardinal directions. Assess the ability to coordinate vision from both eyes, especially in the presence of squint or with and without glasses. Now, the procedures involved: stereopsis, test for suppression, access ocular motility, access ocular alignments, cover-uncover test, prism-based cover test, Thornton rod, Von Graffe method, assess the divergence, assess the accommodation. Now, whatever tests I have told, you can do as many as you want or all the tests, depending upon the availability. Again, next is ocular and systemic health assessment. Evaluation of the ocular anterior segment and adnexa, measurement of the intraocular pressure, evaluation of the ocular media, evaluation of the ocular posterior segment, visual field testing. Again, the procedures involved any or all the tests mentioned: pupillary evaluation, slit lamp evaluation, tonometry, fundus examination, visual field testing wherever indicated. Other supplemental tests: confirm or rule out differential diagnosis, enable more in-depth assessment, provide alternative means of evaluating patients who may not be fully cooperative. For example, optical coherence tomography, visual field testing, gonioscopy, fundus photography, keratometry, pachymetry, glare testing, contrast sensitivity testing, biometry, dry eye assessment, ptosis evaluation, etc. These are supplemental tests. Next is developing a management plan. Now, diagnosing the condition, considering suitable treatment option, correlating with other systemic and ocular features, discussing the condition and available options for management. The steps involved: document the diagnosis, both tentative and definitive. Provide appropriate prescription for refractive errors. Consider occupational needs and relevant prescriptions. Confirm that relevant supplemental tests have been performed for age or health-related conditions or not. Dispensing the appropriate prescription. Write out a clear prescription with all relevant information. Take measurements required for precise fitting of spectacle lenses. Confirm any measurements for contact lens prescription. The steps involved: again, a clear prescription and a legible prescription should be written. Make sure there is no ambiguity in the prescription. Mention refractive error, correct acuity, working distance, if appropriate. Type of use: reading, lens material, lens treatment, and miscellaneous information like protective, etc. Measure the IPD, segment height, pantoscopic tilt, etc. Quality check the glasses prior to dispensing. Discuss the requirements for the best contact lens modality and provide manual about spectacle or contact lens hygiene, etc. Last is miscellaneous. If this is required, discuss the treatment plan and ideal period for review. Set a telephone, email, or in-person appointment for short follow-up or feedback. Refer appropriately. Discuss the condition and management in detail. Follow up with the patients to reassure about comfort, ensure adherence to orthooptic treatment plan, or confirm outcome of referral. Refer for supplementary management. So these are the few tests and the procedures which we have kind of aggregated and made this as best practice standards. And this is again specifically for adults, and more annexures would be coming in, and specialties will be added. So this is a very basic. When we say that, okay, we want to do a comprehensive eye examination, I believe that when I say as general guidelines, these are the tests which are required, and an optometrist following these will be able to do a complete comprehensive eye examination. So now, as I said, that this presentation will be more generic and for people who are aspiring to open their own practices. Now, I have given this question that optometry practice, is it a business or is it profession? It is both. When we look at the business perspective, yes, it provides products and services for money. We, as an establishment, say for example, if I am an optometrist and I want to open my practice, then yes, along with my practice, these are the things which are going to come. I have to pay rent, utilities, my insurance, phone bills, etc. I have to hire, train, and manage support staff. And in all this, I have to have an aim of making profit. Now, when I see my professional perspective, yes, a qualified optometrist will always put the clients or the customers or the patient's best interest ahead of selling a product or service. Now, why I put this is, say, for example, we have seen a lot of times that, sometimes we'll come across that, okay, if we see a practice and a retail store together, then we might sometimes feel that, okay, this is a retail store, so we might not be getting proper clinical assistance inside. But that is not the fact. A qualified optometrist will always put the best interest of the patient before, selling a product. But we have to see this as in both perspective, because if we are establishing a practice, it will be a complete solution. So when we are aspiring to become a businessman along with a professional, these are the things which we need to keep in mind. And if we keep these in mind, then is when we will be able to maintain standards and we will be able to deliver standards. That is what is important. Now, I understand that, yes, as optometrists, we learn in these 4 years, we have learned a lot of procedures, we learn a lot of clinical skills, but when we come to implement them, it is not only that we do the clinical part, there are a lot of other things which we need to learn. And that is what together gives the best practice standards. Now, good practice management, what it is. I am sure that practice management is something which a lot of ourselves, keep on upgrading ourselves. We keep on reading that what is good practice management. Now, few things which I want to touch upon. Respect your patient. Now, we need to be cordial, make them feel valued. Respect their time and yours as well. Provide sufficient time in an appointment for a comprehensive eye examination, keeping room for discussion. Respect and acknowledge the right of the patient to seek another option and choose whom to approach. This is very important. This setup, provide adequate space and resources in terms of equipment. For dispensing services, include wide range of eyewear and coatings. Choose a location that is accessible to everyone. The design of the setup should be accessible for people with visual or other disabilities. Consider alternate entrances or keep a list of such facilities. Privacy and confidentiality. Respect the privacy of patients and their records. Patient examination, conversations with the patient, and any interaction, including lens handling, teaching, must not be in visible or hearing range of other parties. Records of a patient must not be visible or available to another. Management. Apply relevant clinical guidelines and adopt latest evidence-based techniques to manage primary eye care, health, and other visual needs of patients. Provide patients with information about their ocular condition and the results of optometric examination. provide a referral letter with sufficient information about the patient, the condition, and the nature of referral. And at last, a good referral system. Refer any patient whose management is beyond the scope or expertise of the optometric practice. This I'm sure everybody will agree. To guide patients when necessary, maintain and update a directory of ophthalmologists, low vision centers, diabetic centers, physicians, etc. Also maintain a list of local general health and community service relevant to the optometric practice. So these are the few good practice management rules which we have kind of put up together, and I feel that this is a very universal guideline, so that the practice is of very good standard. Now for existing practice, so I'm sure that the guidelines which we just discussed is something which is, of course, when a new optometrist who has just passed out or has few years of experience and wants to explore the potential of setting up the new practice will follow. But what about existing practice? Because we keep on saying that we should keep upgrading ourselves. So upgradation is the key. Now, what upgradations can we look at? We can look at equipments in the clinic and the store. So the existing clinic, what you have, or the existing store, what you have, you can update the inventory. You can put up a new machine in the clinic. Cleanliness and hygiene, yes, there cannot be, no saying that, okay, because we are into healthcare, it is very, very important that cleanliness and hygiene should be maintained, and it can never be less. Staff training, yes. Development of the staff is very important, and this is a team job. When we say that we are, going to set up a practice, it will definitely be a team job. You cannot alone handle anything. So you will have staff, and you will have to train your staff and upgrade your staff periodically. And last but not the least, yes, clinical competencies and specialties. Now you are the driving force of the practice. It is your practice, and patients will come to you, seeing you basically. So keep educating yourself and keep learning. So the existing practice, these are the points where they can work, and the new practice, of course, yes, those are the guidelines. The takeaway points: a best practice is a method or technique that has been generally accepted as superior and to any alternatives because it produces results that are superior to those achieved by other means. It is very correctly said. And when we set up examples like that, then we deliver the best to the community. Now, as I said, that this is absolutely an India perspective. You will have your own guidelines. This might give you a perspective, but it is always advisable that whichever country you are, if you already have guidelines, then you have to follow your guidelines. And I'm sure that OCI, as OCI, we believe that this document will help optometrists set their clinical practice and provide quality and standardized care to the community. Now, this is the best practice standard guidelines, the link. If anybody is interested, then they can download the book, and just for reference, they can always look into it and give us feedback. So that's about it. I think I finished it quite early. Any questions from your end? Over to you.
Thank you so much, ma'am, for such a wonderful session. I guess we have got much insights about the practice standards that we should adopt in optometry. So moving forward, we are now on to the discussion session. So I shall be reading out the questions for you. Are you ready to take the questions, ma'am?
Yes. I'll just stop the screen share.
Yeah, that's all right. So please, can you turn on your video? Yeah. So let me check out the questions. So Rikesh sir, can we have the questions displayed on our screen, please?
Till now, there is no any questions. Wait for a moment.
Okay, so we will be waiting for some few minutes for our attendees to raise the questions. So, ma'am, we have our first question from Mr. Manish. He have asked the question, can you please explain once about what would be the expenses to establish a personal clinic?
Okay, so hi Manish. Okay, it's a very good question. Now, we at OCI, we have developed a document which gives, estimate of a basic, an intermediate, and a exclusive clinic. So a basic clinic, clinical establishment will cost you maybe to somewhere around 3.5 to 4 lakhs, and standard clinic with proper instruments will cost you somewhere around 6 to 7 lakhs, and of course a high-end clinic will go above 10 to 15 lakhs.
I hope that answers questions. Moving
Yes,
forward.
and if you
Yeah.
wish, then I can share sometime, maybe because I will be in touch with Mero Eye team. I can also share the document so that you can have, so we have kind of mentioned the what kind of instruments are required for setting up the basic, advanced, and the high-end, the intermediate and advanced clinics, along with the store. So I can share that document with you, and you can have it as a reference.
Yeah, ma'am, anytime. So we'll be waiting for some few more questions. So let me check out the other questions. So we have our next question. What is the scope of optometry sub-specialty clinics?
Okay, so this you are asking about your country, or shall I give our country's perspective?
Ma'am, you can give the answer in general, considering the both the countries.
Okay, fine. So, see, in general, there's a lot of scope for specialty practices, yes, but the and we keep talking about specialty practices. I understand that yes, specialty practices are it will give you a lot of presence, that yes, you are different from others, maybe because you are doing this specialty. But to grow a specialty, it takes time. You have to have very good skills, and you have to have that kind of a setup, and the base, the patient base. It is not that from the very first day you will open a specialty clinic and people will come. So if you remember the standards or the guidelines which I spoke about, in that referral is one of them. You should have a very good relationship with the other practitioners, not only ophthalmologists maybe, but with other practitioners as well, like general physician. Because if you even have, say for example, you have got a retinal scanner, so you need to have maybe a dietitian in your list, and say that okay, you're doing the photography, the retinal photography. So referral is referral, mutual referral is very important. And yes, specialty practice has a lot of scope, but you have to be patient, and you have to be very positive, that yes, you have set up something different from what others are doing. Along with that, you have to keep a cordial relationship with all your peers so that you have a very good patient base. So that is basically the essence of any specialty practice. I hope I have been able to answer your question.
Yeah, ma'am. Thank you so much for this insights, and I hope that answered the questions. So we don't have any more questions on our live chat box. Despite that, we will be waiting for some few more minutes if anyone wants to come up with the questions. So we have again another question from Mr. Manish. So his question goes as of your practice, would be a optical field like a lens card or a JICE be a good choice or a personal clinic setup helpful for a optometrist in the coming future?
Yes, this is very important. See, that is what I wanted to say in the first place. What we believe is, as an organization, and what I believe as an optometrist myself, uh, self practice or establishing a practice is something which should be a focus or a goal of every optometrist, because that is when the general public will come to know that what optometry is. Because I am not very sure of the situation of Nepal, but in India, because the profession is not known, absolutely not known. Now, whenever an optometrist comes out and starts working for someone else, the profession does not get that limelight, and we do a lot of work, to be very honest. Now, yes, I understand that we need to gain a lot of skills, polish our knowledge, and then we should have some business acumen, some to set up the practice, as I said. So it is always a good way that at the end of the day, you as an optometrist, when you're coming out, you should have this in your mind that, okay, like I will invest my 4 to 5 years of my life in learning skills which are required, to the basic skills, and polish them. Yes, because the entire life we will keep on upgrading ourselves. That is important. But to start a practice, you will require some acumen. Now we will do that, and then our aim should be, I know that yes, 100% will not have the interest of opening own practice, because there's a lot of things which require to sustain a practice. But if you start thinking at a very early age, then at least at some point you will start establishing that, and then slowly establish your practice. So to to kind of establish the profession, establish the name of optometrists, making optometry visible to the community, I think private practice is much better opportunity. It gives much better opportunity than working for someone else, definitely.
So thank you so much, ma'am, for this insights. I guess we have answered almost all the questions till now, and considering the time limits here, I announce the closure of the discussion section, and I would like to express my immense gratitude towards our today's presenter, Ms. Paula, for wonderful insights on the behalf of Mero Eye Foundation and even our participants. So before wrap up, I request our today's presenter, Ms. Paula, to share her few words of honor to our platform.
I didn't get you, Solu. What do you want me to do?
Yeah, ma'am, we are to the end of the today's talk and we are about to wrap up. So before that, what would you like to share with our platform and to our today's attendees?
Okay, fine. So sorry, I lost you in the last part. I was not able to hear you. Okay, so thank you for inviting me in the first place, and I know that this is a little different topic than our day-to-day educational topic in optometry, and I'm sure that you are getting the best of education from the best of the minds in optometry. I chose this topic because I thought that this could give you a small insight of how to establish practice and how you can give more to the community. That is why this topic today. And from the organization front, yes, I work for an organization which is an optometry organization. And I would like to be, as this has started, I have become a part of Mero Eye family, and I've interacted with the students of Nepal and the viewers. If any practicing optoms are there, I would like to keep this collaboration on. And also, I will request you all to please download the best practice standard document and have a look at it. And yes, you can always connect with us at info@optometrycouncilofindia.org. We are available in Facebook. You can follow us on Facebook. And if any queries, we are always happy to answer you. And thank you for having me today.
Thank you so much, ma'am, for your time. So I could see a few more questions on the chat box, but we will be writing those questions to you on the WhatsApp and we'll forward the answers to our attendees.
Absolutely.
So,
thank you.
Yeah, ma'am. So you're with, I announce the closure of today's webinar, hoping to see you all again in the next one. Stay safe, stay connected. Thank you all.
Bye.